A very good day to Dr. Asnong. My name is Tavaneshwari Raman, and today I'll be presenting about the challenges of children with ADHD in Asian and Western culture. And together with me, Yamuna and Meghalay will also be presenting today. So, as for myself, I'll be doing the introduction part and also the diagnosis and treatment of ADHD. Let's look into what ADHD is all about. ADHD is known as attention deficit hyperactivity disorder, which is a brain disorder that affects how you pay attention, sit still, and control your behavior. It happens in children and teens and can continue into adulthood. And ADHD is the most commonly diagnosed mental disorder in children, and boys happen to be more likely to have it than girls, and it's usually spotted during the early school years when a child begins to have problems paying attention. And ADHD can be prevented or cured, but spotting it early plus having a good treatment and education plan can help a child or adult with ADHD manage their symptoms. So when it comes to the symptoms or presentations of ADHD in children, there is three types, which is inattentive or hyperactive or impulsive, or both the combination of inattentive and hyperactive impulsive behaviors. So when it comes to inattentive behaviors, it causes like easily distraction, unorganized, difficulty listening, where they doesn't follow directions or finish tasks, doesn't pay attention and make careless mistakes. They forgets about daily activities and have problems organizing daily tasks, and also often daydreams and loses things. And also, when it comes to hyperactive impulsive behaviors, they have difficulty in sitting at one place or staying still. They need to move their body parts like shake their hands and legs, and they rush through tasks and make rash decisions. So they don't they have trouble sorry, they are always moving, such as running or climbing on things, and they talk excessively and is always on the go as if driven by a motor, and they have trouble waiting for their turn, and they always interrupt people. And at times it could be a both combination of inattentive and hyperactive symptoms in an ADHD student. So when it comes to ADHD treatment, there are several approaches to treating ADHD, but research suggests that for many children, the best way to manage symptoms is a multimodal approach. This involves multiple methods of treatment that work together. Many symptoms of ADHD can be managed with medication and therapy. Close cooperation among therapists or doctors, teachers, and parents is very, very important. So medication, although there is a controversy about their possible overuse, stimulants are the most commonly prescribed medications for treating ADHD. They can help control hyperactive and impulsive behavior and improve attention span. They can act on the brain chemicals like dopamine that can make impulsive behavior worse. And when it, before I mean, sorry. After that, there is therapy. This treatments focus on changing behavior. So the first one would be special educations, where it helps the children learn at school. Having structure and a routine can help children with ADHD a lot. And there is behavior modification, where it teaches ways to replace bad behaviors with good ones. Like your, it makes simple, clear rules, and when they lose control, have them face the consequences that has been set up, and keep an eye out for good behavior, and also keep the children's impulses in check. And there is also psychotherapy, which can help someone with ADHD learn better ways to handle their emotions and frustration, and it would help improve their self-esteem as well. Counseling may also help family members better understand a child or adult with ADHD. And there is finally social skill training can teach behaviors such as taking turns and sharing. So these are all from me, and I would like to pass it on to the next presenter. Thank you, Dr. Aswan.
The exact causes are difficult to determine, but there are several factors as mentioned in findings. First is genetic factors. The inherited gene could be turned out as the significant factor in developing neurodevelopment disorder as ADHD. Second is the head injury or brain damage. The damage in front of human brain could turn out to be the cause of ADHD. Third is premature delivery of smoking and drinking during pregnancy. Can also say that unhealthy pregnancy. The intake of substance abuse like drinking, smoking, and some other substance abuse could affect the development of baby from womb. It also could affect the weight of baby. So low birth weight. The last is environmental factor. Moving on to the social challenges of ADHD faced by children from Asian and Western culture. They are difficulty in peer relationship, lack of impulse control, delayed language skills, communication and interaction difficulties, difficulty with perspective taking, difficulty in managing emotions, responding inappropriately, misinterpreting body language and voice, missing social cues. According to in Western culture, children with ADHD face rejection and isolation, and being little off in just any social activity quickly lead explosion from hyper aware peers as well as teasing and bullying. But so it's slightly different in Asian culture because Asian community had lack of knowledge about the mental disorders such as ADHD. So the lack children with ADHD from Asian culture face the lack of exposure to understanding of such mental disorders, experiencing low self-esteem and started to uh, felt that they aren't strong and smart enough to learning and experiment new things like normal kids, and it builds negative attitudes on their character.
For medical challenges of ADHD, in Western culture, 1 in 2 children with ADHD didn't receive any behavioral therapy. 1 in 4 children were treated only with medication. Firstly, they give behavioral therapy, then they continue with medication. From Asian culture, Chinese parents of children with ADHD give professional assessment and services, no behavioral therapy for evaluating ADHD. Services such as psychoeducational talk, family camp, and online self-help platform. From economic challenges of ADHD, in Western culture, UK stated uh, low range estimate for healthcare cost for ADHD patients are 84 million, that is 8%. Education cost is 648 million, that is 62%, and social services cost is 4.3 million, that is 0.4%. The high range estimate for ADHD patients healthcare cost is 377 million, that is 25%. Education cost 648 million, that is 42%, and social services, that is 4.3 million, that is 0.3%. In Asian culture, for Australia, the total economic cost, which includes health system costs, productivity costs, other financial costs such as education, crime and justice, and dead weight loss for ADHD patients are 12.83 billion. The two pie charts show total financial cost of ADHD by cost component and payer. In conclusion, there are many challenges that have to face by children with ADHD among various cultures. Some rules have to follow by which culture. So both parents and children are responsible for treating ADHD by overcome these all challenges. Thank you.